Today, we're going to walk through a medical guide to abortion. We'll be sticking to the facts based on established medical sources to give you a clear and straightforward understanding of this important healthcare topic. Welcome to MediByte. We're all about taking complex medical subjects and breaking them down with clear, evidence-based information. Our goal is to help you feel more informed about your health. So let's get started.
First things first, let's get on the same page with a core medical definition. According to the MSC manual, an induced abortion is the intentional ending of a pregnancy, and this can happen in one of two ways, either through a clinical procedure or by using specific medications. This definition is really our factual starting point for everything else we'll discuss.
Now, to really understand the context here, you just have to look at the data. In the United States, roughly half of all pregnancies are unintended. That's a pretty big number, and it really highlights why abortion is a significant part of reproductive health care. Okay, here's a quick look at what we're going to cover. We've just set the stage a bit, and now we're going to dive into the two main ways an abortion is performed. That's procedural versus medication. We'll break down how each one works, and then we'll wrap up by talking about the really crucial topics of safety and aftercare.
So let's start by digging a little deeper into the data. Understanding when and how abortions are performed gives us some really important context for the whole medical picture.
So what about timing? Well, the data is incredibly clear on this. The vast majority, we're talking 93% of abortions in the U.S., happen within the first trimester. That's before the 13-week mark of a pregnancy. And this right here, this highlights a huge trend. In 2023, medication abortion, that's the one using pills, made up 63% of all abortions in the United States. That's a massive increase, and it's partly driven by things like a person's preference for privacy and just general accessibility. All right, now let's get into the two main methods themselves. A pregnancy can be ended either with an in-clinic procedure or by using medication. And the choice between them, well, it usually comes down to a few things, like how far along the pregnancy is, what the patient prefers, and what kind of care is available to them. So here's a quick side-by-side. A procedural abortion is done in a clinic and can be an option for most of a pregnancy. Medication abortion, on the other hand, is typically used earlier on, usually up to 12 weeks, and a lot of the process can happen at home after an initial clinic visit. Okay, let's dive into procedural abortion first. From a medical standpoint, this is all about removing the contents of the uterus through the cervix. There are two main techniques used here. For earlier pregnancies, in that first trimester, a dilation and curettage, or D&C, with suction is really common. For pregnancies that are further along, usually after the first trimester, a dilation and evacuation, or D&E, is used. The goal for both is the same, to safely remove the pregnancy tissue. A really crucial part of this whole procedure is called dilation. It just means widening the cervix. And to do this safely, to reduce any risk of injury, clinicians might use medications or these small dilators. Some are actually made from dried seaweed called laminaria. They're inserted into the cervix, and then over a few hours, they absorb fluid and just gently expand, gradually stretching the opening. All right, let's switch gears and talk about the second method, which, as we just saw, is actually the more common one these days. A medication abortion is different because there's no surgical instrument involved. Instead, it uses medicine to make the uterus contract and expel its contents, kind of like what happens during an early miscarriage. The process is essentially a 1-2 punch with two different medications. First, a pill called mifepristone is taken. Its job is to block progesterone, which is a hormone that's absolutely essential for keeping the pregnancy going. Then, a bit later, a second medication, usually misoprostol, is taken. This one causes the uterus to contract and empty itself. So, after a medication abortion, follow-up is really important, just to make sure the process is complete. Clinicians have a few ways to confirm this. They can use an ultrasound, do a blood test to see if the pregnancy hormone levels are dropping like they should, or have the patient take a urine pregnancy test about 5 weeks later. And if, in a rare case, the medication doesn't work, a procedural abortion might be needed. Okay, now we're moving into what might be the most important part of this whole conversation: safety and aftercare. Understanding the real risks and what happens after the procedure is absolutely critical for a patient's well-being. So let's just get right to the safety profile. The medical consensus is clear. When an abortion is performed legally by a trained professional, it is a very safe procedure. In fact, serious complications happen in less than 1% of cases.
To put that into perspective, that's a lower complication rate than what's seen after delivering a full-term baby.
Now, of course, each method has its own set of potential side effects and, in very rare cases, complications. With procedural abortions, an extremely rare risk is something like perforation of the uterus. For medication abortions, the most common side effects are actually expected, things like cramping and bleeding, and sometimes nausea or diarrhea. Aftercare is really all about the patient's overall health moving forward. Contraception can be started right away to prevent another unintended pregnancy. For people with an Rh-negative blood type, an injection is given to protect any future pregnancies they may want to have. And just as important, patients should always be offered access to mental health resources for emotional support. So let's quickly recap the most important takeaways here. 1. An induced abortion is a medical process to end a pregnancy. 2. There are two main distinct methods, procedural and medication. And 3. Based on all the medical data, when it's done legally by trained professionals, abortion is a safe procedure with a very low rate of serious complications.
And we'll leave you with a final thought. It doesn't really matter what the topic is. How does having clear, fact-based knowledge about any medical procedure empower all of us to make better, more informed decisions about our own health and well-being?
Thank you so much for joining us here at MediByte. If you found this information helpful, please do us a favor and like, share, and subscribe. It helps us keep making more clear, factual explainers on important health topics. We'll see you next time.